Hello guys and welcome back to the channel. Today we will be taking an in-depth look into hip fractures. We will dissect the different types of hip fractures such as intracapsular and extracapsular whilst explaining how these may affect patient prognosis and treatment. Let's dive in. Before we dissect hip fractures, let's take a look at the normal hip anatomy that we should expect to see on a radiograph. The hip is a part of the femur bone, more specifically the proximal femur. It sits in a socket known as the acetabulum. This is where the femoral head sits and therefore forms the hip joint. As we move more distally down the hip, we have the femoral neck. In practice, you will often hear hip fractures referred to as NOFs. This stands for neck of femur fracture. We can see that we have a greater trochanter and a lesser trochanter, respectively, located on the edges of the hip. The greater trochanter always sits more superiorly to the lesser trochanter. Lastly, at the distal end of our hip X-ray, we can see the proximal third of the femur, which is where the femoral shaft begins. Now that we have outlined the basic hip anatomy, let's begin to break down the types of fractures we should expect to see on a hip X-ray. Fractures are classified as intracapsular or extracapsular. This classification is an important tool in the treatment pathway for hip fractures. Femoral neck fractures may affect the blood supply to the femoral head. The femoral head's only blood supply is located within the hip capsule, and if it is not treated correctly, then this may lead to necrosis of the femoral head, essentially meaning a loss of blood supply to this part of the bone. So if we look at intracapsular fractures, these are fractures which occur within the hip capsule. You can remember this as intra, which means inside of. In essence, these are fractures which occur proximally to the intertrochanteric line and are highlighted by the green shading on this hip X-ray. It makes perfect sense to then assume that all fractures occurring outside of the hip capsule, i.e. more distally to the intertrochanteric line, are classified as extracapsular hip fractures. This would be all fractures occurring within the purple shaded area. Fractures occurring more distally to the purple area would be classified as femoral shaft fractures, and we will cover these in another video. The treatment for intracapsular fractures will depend on the type of fracture that has occurred. Here we have an example of a non-displaced intracapsular hip fracture, meaning that there is a fracture within the hip capsule, but the break has not caused significant displacement. Non-displaced hip fractures like this one may be treated using cannulating screws, as shown in this radiograph on the right. This radiograph belongs to the same patient who suffered the fracture on the image on the left-hand side, and we can see how the cannulating screws have been inserted in order to stabilize the fracture through the healing process and maintain alignment. The approach for treating displaced intracapsular fractures will be slightly different to treating non-displaced ones. Here we have a radiograph displaying a displaced intracapsular hip fracture. These fractures will often be treated by way of deploying a total hip replacement or a hemiarthroplasty. In a total hip replacement, both the femoral head and acetabular socket will be replaced. In a hemiarthroplasty, the femoral head will be replaced, but the acetabular socket will be spared. We are now going to talk about the treatment options that you may see used for extracapsular hip fractures. As extracapsular fractures occur outside of the hip capsule, there is no interference with the femoral head blood supply. A DHS, which stands for dynamic hip screw, may be used in order to treat an extracapsular fracture. The DHS will allow for controlled compression whilst maintaining alignment during the healing process. In other extracapsular fractures, which are more complex or occur more distally, an IM nail will be the preferred option of treatment. Now that we have broken down the difference between intracapsular versus extracapsular fractures and the treatment options that are available for both, I would like to talk you through the different examples of each fracture type that we may see. On the diagram on the left, we have all of the intracapsular fracture types such as subcapital, transcervical, and basi-cervical. Sometimes basi-cervical fractures may be classified as extracapsular as opposed to intracapsular. On the other diagram, we can see the examples of extracapsular fractures such as intertrochanteric fractures and subtrochanteric fractures. The jagged lines on each diagram represent the location of the fractures, and their location ultimately gives them their names. Let's quickly run you through some examples of each fracture type. Here is an example of a subcapital and therefore intracapsular fracture. These are fractures which occur immediately below the femoral head and are the most common type of intracapsular fractures. Next, we have two examples of transcervical fractures and therefore intracapsular transcervical fractures. These are fractures which occur across the mid portion of the femoral neck. Here we have an example of a Basi-cervical fracture. Depending on the type of this fracture, these may be intracapsular or extracapsular. These are fractures which occur along the base of the femoral neck. Next, moving on to the extracapsular fracture types, we have what is known as an intratrochanteric fracture. As you have probably guessed from the name of this fracture, these are fractures which occur between the greater and lesser trochanter, as shown by the examples on your screens. Lastly, we have a subtrochanteric fracture example, and therefore another example of the extracapsular fractures. A fracture which is within 5 centimeters of the lesser trochanter is deemed subtrochanteric. Any fractures occurring more distally than 5 centimeters will be deemed a femoral shaft fracture. And with that, guys, we have reached the end of this video. I hope you now have a better understanding of hip fractures, the different types of hip fractures that we are likely to see, and their subcategorization, and lastly, the treatment options that are available. If you enjoyed this video, please don't forget to like, share, and subscribe. See you in the next video.